another episode of the Therapy with Rikki podcast, where we talk about real conversations that you can feel. I am your host, Rikki McCoy, a licensed holistic therapist in Atlanta, Georgia, and I'm excited to be here with you all today to talk about a very, very important topic. So let's get into it. If you are new to my channel, thank you so much for tuning in and listening and being on your wellness and your healing journey wherever you may be. And if you have been tuning in for some time, welcome back. Please be sure to share, subscribe, and just send this to somebody who you feel like can benefit from this message. All right. So today we have a very special guest that I am excited to introduce to you all. Miss Tiffany Bates is a nurse practitioner, a psychiatric nurse practitioner, and she is the founder of Growth Mindset Wellness. And she is doing some great work to bridge the gap to eliminate any barriers, anything that may be there when it comes to psychiatric medication. Okay, so I want to introduce you all to Miss Tiffany Bates. Tiffany, how are you doing today?
I'm doing well. Thank you for having me, Rikki. I feel so honored.
Yes, thank you for being here. I have been working with Tiffany for a few years now, and I'm just excited to have this conversation. Introduce yourself to the people, tell them more about yourself and your practice.
Okay. Again, my name is Tiffany Bates. I'm a psychiatric and family um, mental health nurse practitioner. And my practice right now is out of Stockbridge. So, growth mindset wellness has come about over the last couple of years, but brick and mortar wise, I opened up last year. So, it's been right about a year that I've been open and actively seeing patients with pretty much a full caseload. And basically, what I do is medication management. I've been working in mental health for the last almost 4 years as a nurse practitioner, but prior to that, even as an RN, I have over a decade of mental health experience. So apparently, I must have been called to it. I don't know. But
Yes.
because that's why you hear the family. I try to go to family, get the family certification first, and then I end up only being able to really get a job in mental health. So it's a calling, but basically I see patients for medication management, and I help I diagnose of course to see what we're dealing with. And then based on the diagnosis and the assessment and evaluation, I determine if a patient is a candidate for medication. And more often than not, they are. There are some times where they may not be ready for it, but basically, I recommend whether or not I feel like medication would be beneficial. And pretty much, it's up to the patient to decide if that's something that they want to do. And from there, we come up with a treatment plan to initiate start a medication.
Absolutely. Now, I work with Tiffany personally, and I also refer clients to her if I feel like, okay, we're doing therapy, we may need some additional support when it comes to your treatment plan, right? Like your mental health and your wellness. Tiffany, what are some of the common misconceptions that you feel like people have about psychiatric medications?
Oh, that is going to mess with their brain chemically to the point of no return, and that, they'll be dependent on it, forever or to the rest of their life, or it will be something that'll be a challenge to get off of if they ever decided they didn't want to be on medication anymore. Um, and basically also just like observing other people's experiences and making that their own before they even gave medication a chance themselves.
Absolutely. I hear that a lot too in my practice. It's just like, oh, well, so and so had this experience and I don't want to be dependent on it. I've heard that a lot too. And so, I like to remind people that this is your experience. Everybody's body is not the same, right? And let's try it. Let's give you a chance to see how the medications can help you. What are some of the ways that you feel like the mental health medications help clients, help people? to do better, feel better, all of the things.
Well, one of the biggest things is that it helps people to be able to sometimes just function. Like I explain to patients all the time when it comes to developing a diagnosis, is that um, if you're at a point, like everybody has stuff going on, no one is exempt, right? We're all humans, and every human has, they deal with depression, anxiety very minimally at some point in life. So, however, how that affects one individual to the next really varies, right? Some of us have, a situational bout of depression and or anxiety, and some of us chemically, like we're just dealing with it on a very regular basis. And, I would say that it's difficult to sometimes figure out where some of that is coming from,
Hmm.
you know? So redirect me on the question one more time, because now I'm getting off topic.
Yes. Just how do you feel like when somebody had when
Oh,
they
that it can help them. It can
yeah,
help them.
how can it help
Okay. So yeah, a lot of times people don't understand that where their depression and anxiety is coming from, and they don't realize that it can help them. They don't realize that medication can be helpful to them. But as far as some of the ways that it can help, it helps people be able to function. Like I was saying, that people struggle with depression and anxiety, and I was trying to elaborate and say that it start when your depression and or your anxiety starts to affect your ability to function.
you?
That is when it is becoming a problem that you just may need to do something about.
Yes. Yes, absolutely.
Whether that's therapy and or medication. It's just when is affecting your functioning, and then when you get on a medication that actually is effective for you, you will see that your functioning will improve. And when I say functioning, I'm talking about the ability to get up out the bed and go to work every day, or even to get up and take care of yourself.
Mhm.
Um, it's those simple things that we take for granted and we don't think about. But when you're down in the dumps, you recognize, like, hey, look, I don't even feel like getting up today.
Absolutely.
So minimally, it helps with things like motivation, ability to function. So just giving you some umph to get up and do the things that you have to do, even taking a shower, taking, a bath,
Mhm.
even eating, you know. So it definitely helps a lot with just to some degree restoring you back to like a baseline functioning.
Absolutely. Those are some of the same things that come up for me too when I'm explaining, like, hey, like we're not really functioning at our best. You don't really have the motivation to get up and go. It's hard for you to get up. We're oversleeping or we're not sleeping.
Right.
Our appetite is off, our focus, because people, even helping people understand, it could be ADHD or it could be depression. Like we have signs and symptoms that kind of look similar. So, like, let's go
Mhm.
and get you the proper diagnosis to see what it really is. I think another thing for me too, especially with anxiety, is like the somatic, like how it's showing up in your body in the somatic ways that it shows up, and how
Mhm.
medication can help you like really slow down that fight or flight so you can think and process and function.
Absolutely.
Yeah.
Absolutely. That's definitely a big one too, as far as just how a lot of times you could be having an issue with anxiety that you don't even recognize to be anxiety. And then you're also recognizing that you're having issues with sleep, not knowing that that is a form of how anxiety affects your body, like you just said.
Right.
And people don't realize the connection and how much, like, when your brain just doesn't want to turn off, which is anxiety, it will affect your sleeping patterns.
Yes.
And
Absolutely.
sometimes by treating the anxiety with the anxiety medication without you having a direct sleep aid, but just having that right anxiety medication will then improve sleep too.
Absolutely. It definitely will. And that is me speaking from personal experience. So,
Mhm.
just knowing that the help is out there, the research is out there, really building a support team, whether that be your family physician, your nurse practitioner, your therapist, so that you can get referred properly to the right referrals, right? So that you can get the help that you need. Have you heard? I know a lot of times some people they'll say they'll get their psych medications from like their family doctor. Can you share the difference and why it's important to go to somebody who may specialize in mental health?
Absolutely. So the first thing, again, having gone through both programs and specialties for family and mental health, right? I understand that when you go through as a family medicine provider, it's not inappropriate for them to treat mental health, right? It's when it's very manageable and it's not complex.
Right.
That is the only time that, family medicine providers are encouraged to help with mental health. And they're encouraged to help with mental health because there's still such a shortage of providers in the mental health area, right? So family medicine actually was encouraged, like, hey, this is, a lot of people deal with depression, a lot of people, deal with anxiety. Like, this is something that if a person is having an issue finding a mental health provider, that you can at least initiate treatment, even if you do want them to see a mental health provider or, refer them out. But I do have, a lot of people come to me and say, "Oh, my mental health, my family medicine provider started me on this medication, but they really wanted me to see a specialist, and so that's why I'm here with you." So really, they can. It's just that they really shouldn't bite off more than they can chew, so to speak. If
Right.
they feel like it's something that they is too complex, they can't handle. If they feel like they got to start mixing, certain types of medicines together, that really should be left for the people who had the full training to know how to do that. Because you do learn a little bit of that in your regular traditional family medicine program. You do learn a little bit, but you don't learn a whole lot.
Absolutely, absolutely. What are some of the trends that you're seeing in your practice today around male versus female, diagnoses? Like, what are some of the things that you're seeing a lot of?
Definitely more female than male. I think we are just more in tune with our feelings and all of that and how we feel physically. So we're more apt to go to the doctor, period. But definitely when it comes to mental health and how we recognize it affects us, we are definitely more in tune with seeking the help we need with that versus, compared to men.
Absolutely.
Um, Diagnoses wise, of course, like I mentioned, there's a lot of depression, there's a lot of anxiety, um, there's a lot of, personality disorders, there's, growing psychosis occurring, looking like schizoaffective schizophrenia,
Mhm.
but there's those general and mood disorders, of course, bipolars. Um, are going to be your baseline of diagnoses that you see the most frequently. Um,
Yes, this is why it's so important, y'all, that we again create the support system. And your support system is your practitioners, are your medical providers, right? Like really having the people in place so that you can get the proper diagnosis, or maybe it's not a diagnosis, right? Maybe you're going through a certain chapter in your life, but being able to definitely go and get that second or sometimes third opinion and really advocating for yourself, right? Like these are the resources that are here that are available to you. And let's use them to our benefit. I always like to share with clients, like, you have the resource. If you do have it, like, let's go and let's make sure that you get the help that you need.
Yeah, same here. I say, look at therapy. I said, just like I'm sure you look at therapy as a resource, that's
Mhm.
how I really encourage people to look at medication. It's a resource, like you can pick it up and put it down, even though you really shouldn't, but it's not something that you have to be on forever,
Right.
if you don't choose to. But if you decide you don't want to continue your medications, for me, I always encourage my patients to let me know. Let's have a conversation about it. Let's talk about the pros and cons of what that would look like. And if they're adamant, then we talk about a treatment plan for appropriate, a safe and appropriate withdrawal, like what that's going to look like. You'll have a little bit of it. There's no way to completely avoid it, but just giving them realistic expectations, in
Absolutely.
a safe way.
Yeah, let's talk about that. Let's talk about how medication and some other holistic approaches, whether it's therapy, mindfulness, exercise, like having certain different providers in place, how does that work together when it comes to mental health?
I think when you have a combination of things that you utilize, as far as like working with a therapist, taking medication, if you do any meditation or yoga on your own, or if you go to classes for it, I think having multiple resources, as we call them, available to you and and actually utilizing those resources collectively help you, in your journey of self-care, right?
Absolutely.
It's not just going to be one thing that fixes everything, for lack of a better way to say it, but it's not going to be just one thing that makes it all right. So
Absolutely.
you can't, so like even like we kind of talked about already, like when people ask about, oh, am I going to be dependent on medication? Um, no, but not necessarily. And I always say that's up to you. Like if you're going to have to take this long term or for the rest of your life. It depends on the work that you're also doing in the meantime. The medication is to help you as you are going through something emotional, usually, that you cannot control how it's affecting your ability to function. The
Absolutely.
medication will hopefully allow you to function. So
Hmm.
you can still keep going and pushing forward as you're getting through a struggle or a challenging time or, something like that. So, collectively, the things that you do besides just taking a medication or even talking to your therapist, those other things that you do to help build you up, meditation, affirmations, whatever, those are going to be some of the things that are going to hold you up as you are going through things because sometimes your therapist may not always be available. Sometimes, you might have to wait a minute to get an appointment with your mental health care medication management provider. But the bottom line is you have to be able to know that you have resources available and you have to work with the resources that work for you.
Absolutely, absolutely. Yes, and even something like I love to educate on, like, go to when is the last time you had a physical? Have you had your labs drawn? I know that's something that you do too. Like, what's your vitamin D level? Like, what are, because there are other things, other supplements, other things that we can do to improve our mood. And so just providing that psychoeducation around all of those things is very, very beneficial.
Right. Absolutely. That's definitely something as you just mentioned that I do very often. I often or will always typically will ask questions like, when was your last physical? And there some people have said, well, I mean, why are you worried about that? Well, because
Yes,
sometimes when you're dealing with mental health, it could be a medical underlying cause that looks like a mental health issue. So you want to rule that out
right.
you know? So there's certain red flags to me that when people mention it, when they come to me, I kind of know like, okay, I need to do some labs ASAP because this sounded more like there's some kind of deficiency there, or let's at least rule it out,
Hmm.
because that can actually be a simple fix. If it's a vitamin D deficiency, that if your vitamin D is really low,
Yes,
or and none of us is going and standing outside all day,
right.
and melanated people, it's hard for the vitamin D from the sun to penetrate our skin. So
Mhm.
we are, a lot of us are deficient. And you'll sit up here, you'll have all of these symptoms that look like depression, but it really could be, especially feeling tired and no energy. More often than not, people have vitamin D deficiency.
Yes.
And that is one of the, big symptoms for vitamin D deficiency, like lack of energy, feeling tired. Like you could have slept a good 8 hours and you still wake up feeling like, not, like you haven't slept at all.
Hmm.
And that's speaking from experience, you
Look,
know.
same. Yeah.
So it's like it is important to, as providers, that we collaboratively kind of like look over each other's shoulder and that like I often ask my patients too, like, when was the last time you spoke with your therapist? Have you spoken with them this week? Or what's the frequency of your visits?
Right.
Just to know what else and what other resources the individual is using because it's all gonna help at the end of the day.
Yeah, we all work together for sure. I know I have a chiropractor on my team, right? So I can go to
Hmm.
her, and I even try to educate people how, like, your nervous system is in your spine, like that. is very helpful as part of your treatment plan. Your nutritionist, you know, doing different things, having a team to when it comes to your healthcare and your wellness, for sure.
Absolutely.
Yes, yes. Are there any developments or anything exciting happening in the mental health world that you're excited about that sparks you or gets you going?
Um, well, I like the fact that obviously with technology, things are always going to be improving, right? And I know that mental health still has quite a long way to go because it's only as of recent, like in the last, solid decade, maybe plus, but definitely since COVID,
Yes.
that more people are embracing talking about mental health and even seeking treatment for it. So, with that being the case, we have um, the gene site test, which is not a medication, a medical test
Okay.
that tells us genetically from a metabolism standpoint how the psychiatric panel of medications, the different areas of psych meds, how they may metabolize in your body. So, and it creates a report. So that's pretty cool because it helps us understand from a metabolism standpoint and how your genes work with those meds, what
Hmm.
medications are going to be ideal for you, where we should start. So it gives us some guidance in that way, you
Nice.
know, because a lot of people, when it comes to mental health, especially if you've tried something that wasn't effective, just depending on the individual, and on average, most people are not apt to want to like try a bunch of different things, and then they start feeling like they're a guinea pig. So
Hmm.
that's where a test like GeneSight, for example, and GeneSight isn't the only one, but there's other ones like GeneSight 2 that may have more features. So to sum it up and answer your question, I like the fact that mental health is growing. Um, More particularly, what's happening is we understand how mental health affects our body and understanding like also now the hormonal connection with a
Yes.
lot of mental health symptoms. So you have a lot of mental health providers offering hormone replacement services and stuff like that, which is helpful because sometimes it is something being off with the hormones.
Yes.
And if, the mental health professional obviously doesn't necessarily offer that service in their practice, that's always something that you can refer and say, hey, you might want to get your hormones checked with your OBGYN, or something like that, so that, we can make sure, again, we're ruling out any underlying medical causes. So, but that's something that a lot of mental health, providers are doing, and also tying in nutrition and diet. Um, and how that obviously plays a role what we eat and how that makes us feel. There's just a lot of information and research and scientific evidence coming out supporting like how all of this affects us mentally, even like being overweight and being obese and everybody's on the GLP-1s and losing all of this weight and realizing like even with weight loss that they're feeling better,
Yeah. Yeah.
it's big. So there's a lot of things that's coming out that isn't specific to mental health, but it's having a like, I don't know what's the right term, but
It's that holistic, like mind body connection. Like it's all connected.
right, right.
Hmm.
Yeah, like it's kind of it's like it's not specific to mental health, but it's having like a overlapping, I guess, effect where it's benefiting mental health.
Yes.
So I'm observing how all of that works together, even though it's not anything specific to mental health.
Yes.
What one thing that's out that's kind of, I don't want to use the word trendy, but it's growing is ketamine.
Okay.
Um, Ketamine is for treatment resistant depression. So
Okay.
that's actually kind of something that you want to use as a last resort.
Hmm.
It is a controlled medication, but it's something that for those who really, really struggle with depression and they've tried all these different meds and nothing seems to work and hit their receptors, this
Hmm.
is supposed to be like the end all be all, like this should work.
Yes.
And so ketamine is on the rise, whether you're getting it infused, whether you're, maintenance wise taking it using the aerated dispenser. It's so ketamine is a big one.
Nice. Well, one more question. I have one more question for you. What would you say to somebody who wants to try medication, or they want to at least get a referral and they don't know where to start? Like, what advice would you give to a person that's just curious? They don't really know where to start. They think they could benefit from medication. They may have been told they could. Like, what would you say to them?
So basically, I would recommend starting with sometimes you can call your insurance and they can give you a list of people to reach out to. Other times, if you are seeing a therapist, it's always helpful to ask your therapist if they have any recommendations because that can make life a lot easier.
Yes.
There's Psychology Today, that you can go on and find a provider that you're looking for, whether it's a therapist or a mental health provider like myself, a psychic nurse practitioner. It's an easy way to find, what you're looking for. That's a very easy way to find one. So those resources and just Googling, maybe doing a local Google search, of course, is helpful too. But definitely if anyone refers someone to you, that's likely going to make you feel comfortable because you know someone else that's using that individual, and especially if they've had a positive experience. So, that's how I would say is, an easy way to get started.
Absolutely. And this is just, for me, just curiosity, just what your experience has been. But it also feels safe when it's somebody that looks like you, talks like you,
Yeah,
like somebody that you can relate to. What
right.
has been your experience with that?
Absolutely. A lot of people who are like us, of course, right? Like we know it's taboo in the African American community, right? So the first thing that people do in our community, they do want to go to someone that looks like them. And they'll tell you that.
Yes.
Like I was looking for someone, I was Googling and I had to make sure they was black. And I'm like, okay, However, so that's cool. That's your preference, right? But I do have a mix of clients
Mhm.
that I do, and it's almost surprising to me how much I do. But I do have a mix of clients, but you're right. Like when it's someone that looks like you, it definitely gives you more of a comfort space because, you feel like there's some relatability there.
Absolutely. Yeah, I think to your point, energy is just what it is, no matter shape, color, whatever, race, gender, all of the things. So,
Right.
but I'm definitely glad that we are in this space and we can really break these stigmas around mental health treatment, mental health
Mhm.
wellness, right? Like you can take medication and function and feel better. And there's proof, there's research. Like just like if you were taking your physical medication for your physical
Exactly.
illnesses, we have mental health medications that benefit us as well.
Right. And one thing I want to say and add real quick, one of the common things that I hear people say after they start medication and it's actually something that's working for them that they're able to notice is that they say, why didn't I do this sooner?
Yes, absolutely.
Why didn't I do this sooner?
Yes.
I was so scared. I'm just mad that I haven't done this sooner. Like I feel like a normal person again, or I feel better than I did before, so it's like you really can't knock it until you have your own experience with it.
Absolutely. And just because you are functioning, you may not be functioning at your best. You may
Hmm.
you may can function better. You may can think better, make better decisions, have motivation, have energy, drive, all of the things. So just being
Hmm.
open to the experience.
Exactly.
Yes.
Absolutely.
Yes. Any final words? Anything else you want to share? I definitely want you to share how people can get in contact with you.
Okay. Well, I just want everybody to, again, use your resources. Today's world is crazy. And I say this to all my patients and clients all the time. Like, we have to help each other. So if you have access to mental health care and you're going through any sort of struggles that you can't get through on your own, I definitely encourage you minimally to speak to a therapist first, to not even just jump to medication, but try to talk to somebody first if you're comfortable doing that. And then if that's not enough, and if your therapist recommends it, or if you just feel like that's where you are and you're sick and tired of being sick and tired, then be open to medication because it works.
Yes,
It sincerely works when it's the right fit and it's the right thing for you. It is effective and it makes a world of difference.
absolutely. So true, so true. It does help. You feel better, you feel stable, right?
Hmm.
It's like if I'm in fight or flight or if I'm in survival mode, it's hard for me to think about anything else other than that.
Exactly. And imagine people who feel like that all the time.
Right.
Like
So
how? How are you functioning?
absolutely. So, y'all, we want to get out of survival mode. We want to flourish. We want to grow. We want to continue to elevate. And mental health medications may be just the way for you to do so. So, Tiffany, tell the people how they can find you, how they can connect with you, if they need any help or assistance or questions.
Yes. So again, the name of the practice is Growth Mindset Wellness, and the website is gmw.care. I'm also on Psychology Today, as I mentioned. And then I do have a Instagram, and I think it's Growth Mindset Wellness PC.
Okay.
Um, and we have a Facebook as well, so you can just look up the name and it should come up pretty easily. But yeah, I'm in Stockbridge, so I do offer face-to-face appointments as well as virtual
Yeah,
online. So yeah, hit me up if you are open to medication. I'm here to take the journey with you and figure out what's going to be the best thing for you, but just be ready, to understand that it's a journey and we'll get there, but I'm in it with you to the end.
absolutely. And are you licensed in other states?
I am. I
Yeah.
actually am. I'm licensed in New York, Florida, Arizona, Colorado. I'm missing like two.
Okay.
But yeah, I'm licensed in about a total of 7 states. So yeah. So if
Yeah.
anyone's in those areas, you can also reach out to me as well.
Absolutely. And I will post her website as far as getting in contact with her. I will post it in the podcast notes. So y'all be sure to check
Thank you.
Tiffany out. Tiffany, thank you so much for being here and for having this conversation today.
Thanks for having me.
Yes, I'm so excited that you're here and that we just, we're doing this work.
Me
So
too. Thank you.
absolutely. Y'all take care of yourselves. Please be well and reach out. Hit me up, DM, emails, therapywithrikki@gmail.com. On Instagram is therapy with Rikki, and the YouTube is also therapy with Rikki. Y'all take care, and I will see you next time. Thank
All right. Take
you.
care. Thank you, Ricky.